senior, and I do believe and agree with everything that has been said here, and that we all have a human right for affordable health care. But I also believe that we have a human right to choose the type of treatment that we want. Right now we are in a stage, a period whereby a lot of people are turning to holistic medicine, alternative medicine, and for many reasons. And we know that's going to be a big fight with the pharmaceutical drug companies. But I would like to know, because I have experienced and observed suffering from not being able to choose the type of health care that I want. When I was able to afford it, great. And now that I'm not able to afford it, as a matter of fact, the Borough President talked a lot about holistic, plant-based diets, and we had holistic doctors, and as I spoke to them, the fee for going to a holistic doctor, and we're not talking about quack doctors, we're talking about doctors who are certified and qualified as doctors, and who have advanced or more knowledge on treatment of diseases, which have been proven by many researchers and studies that plant-based diets and holistic medicines are healing a lot of people without the side effects and the negative things that happen with the traditional medicine. I'm not saying that regular doctors don't have their role to play, but I believe that as a human being, I was created with the right to choose, and I would like to choose who I want to heal me. And I would like to know if this New York Health Act, are we going to put on it that alternative medicine, attending a holistic doctor would be covered by such, because right now it's like, one of the doctors told me, Medicaid might only cover maybe 10 to 15 minutes with me, and that's it, when I might need a whole, lot of hours and weeks for treatment. So I would like to find out that. There are a lot of people that are interested. It's a growing population, it's even affecting the retail companies or manufacturers of electricity and food are more educated and are going to making better choices.
Yes, I think that's a very important question. At this point, in great detail, I'm not sure it is actually dealt with within the legislation. However, there is increasingly the field of integrative medicine that does recognize the importance of what you're talking about, alternative forms of medical treatment. So that's something to pay attention to keep looking for, and for us to be talking with the legislature about. I certainly feel it's very important to be able to reimburse, for alternative medicines.
I just want to say one more thing. It's very easy for us to talk and read and to act, but in these types of workshops, it's provided in all communities and getting everybody involved and pressuring our representatives in government, I think we get faster action.
Correct.
Just waiting and depending slow, I believe there's a problem for it, a solution for this problem, and I believe with faith if we go forward with power, we can get what we want. Faster than we can.
Seeing a gentleman in the back.
To Katie, can you let me know when we return to Albany? And also, when you get word, please email all the details to me. There was some confusion when I traveled there in 2016. I should have traveled with Julie Wagner. I said I traveled with a clown from my borough, traveled my borough, 3600 Jordan by Oklahoma Cemetery, back on the park. And I told Julia I was better off traveling with you. So when you get the details, please email it to me. You have my email address?
We'll make sure that we follow up with you, sir. Just a quick note, we're going to have time afterwards for more questions, but if we can keep things brief in your questions and also keep things like more broad, that would be amazing. So I saw next Judy, and then I'm seeing a lot of hands, so we will get to you guys.
this is more of a, I think, a tactical question. Wouldn't this require some sort of federal waiver to get Medicare and Medicaid on board if New York should pass this?
Yes, it does require that. And you could then ask, subsequent to that, what is the chance of getting such a waiver? And that's a very interesting question. As you know, the Trump administration has been leaning very strongly to the notion of block granting Medicaid. Okay, we certainly have not favored that, but in some ways, that's what we're talking about, is a block of Medicaid, federal Medicaid money going into the healthcare trust fund. Then the other question is Medicare. Very important. What's going to happen there? And what people had thought about is, let's say they would deny a waiver for the Medicare money going into the trust fund. One of the innovative ideas that's been thought about is that Medicare has a program called Medicare Advantage, right? Which has been interpreted largely as a program that allows private health insurance companies to manage the beneficiaries' Medicare spending. Well, maybe the New York Health Act's trust fund would become the managed care program. And as that would require a waiver. You could do
does
that.
Does it have to be voluntary for people to join an Advantage plan?
Yes, but again, what you would do, it seems to me, in any single-payer program, you would in fact prohibit private health insurance from duplicating the public coverage. Okay? So what you would find is that there would be no private insurance that would offer Medicare Advantage. And it would seem to me, in that context, most people would say, oh yeah, I'm going to do this.
Do you think our current president would buy this?
I don't know if he would buy it or not. I'm not sure. Our idea here is that it wouldn't be necessary for him to buy it, because in fact it is part of what is, the Medicare law.
And one thing I'm going to say also is that what we want is to provide one form of health care, not different choices. It should just be one plan, let's just say, or one form of health care, so that way everybody has the same access to the same care in the state. One thing that we do see is in the Medicare Advantage plans, and as soon as they start saying, the government, they love to say, well, we're giving you more choice. More choice is that these other plans are mostly private enterprises that really care about a bottom line, and that would be the difference with a New York State health plan, which would be administered by a government entity, a New York State government entity with that 2% administrative cap.
And what Medicare Advantage does is limit you to a network of doctors with whom, and hospitals, with whom the private insurance entity has negotiated, a relationship. One of the interesting facts is that Memorial Sloan Kettering Cancer Center doesn't take every Medicare Advantage program. So you get cancer, you don't have a choice of going there. But under the New York Health Act, you would have that choice.
The other thing is that the portability would not, would be sort of like original Medicare. You would be able to travel out of state if you needed to and you use your Medicare card as an ID purpose, and the state would be paying for those services. So the issue of portability, which is what most people are attracted to with original Medicare, would stay that way.
Thank you all. I'm seeing a man in the back, and I've got you. Yes. All right. Well, a couple of faces I'm seeing. Well, let's start with the man in the back.
Thanks. Hi. I'm an IBCLC. I'm a lactation consultant, and currently Medicaid is not covering lactation services unless it's provided by a doctor or a nurse, like a licensed healthcare provider. I'm an IBCLC. There is no license for lactation consultants in New York at the time. Will my services be covered because it's such preventative care? It helps not just the baby, but also the parent who's nursing that baby. And if we catch the problem early, then they can go on and nurse as long as that parent wants to nurse their baby. And I was just reading the Academy of Breastfeeding Medicine's journal is just putting out this month an article about hypertension and how it affects the mom decades later. So this is like a long-term preventative care issue, and it's really important to get that covered also. So is that going to be included? And like the doctors who are not accepting insurance and are only private pay, or is that going to be covered? Like how does that match up?
And it's a good question. Again, it is not explicitly in the legislation now, but, you know, how do you get lactation coverage presently? Frankly, there is none, right? But under the New York Health Act, you would have, it seems to me, the ability to negotiate for that, which I think right now, because you have so many multiple private health insurance entities out there, you know, you just aren't going to be able to negotiate to, in fact, get that kind of benefit. So, albeit that it's not in the legislation now, it seems to me it's possible. It's possible that negotiating for that kind of preventive benefit would be something that could happen under the New York Health Act.
Now, do I have to become like an in-network provider for this, or this is automatically covered?
Well, I think that's what gets negotiated, right? I mean, the same issue would apply to, you know, midwives, and would you have to be licensed in some way, or could you become a lay midwife? I mean, those are serious issues, no question, but they're not solved, frankly, at this point in the New York Health Act.
Hi, I've lived with type 1 diabetes for 30 years. We immigrated here from the Soviet Union because there was no access to medicine there. And the gross irony now is that insulin for type 1 diabetes, which is fatal without insulin, is one of the 7 most expensive liquids in the world. And to respected Borough President Eric Adams, it's important to distinguish between type 1 and type 2 diabetes. But so I am curious how this would allow for negotiation with pharma, because there's an oligarchy of 3 insulin manufacturers who control the mass manufacturing of it. And so Medicaid and Medicare, as we have it now, aren't able to negotiate for lower drug prices. So how would that happen?
Well, you know, I think that if you had a single entity, again, insurance entity, it would be able to negotiate with the pharmaceutical industry, provided that it represents, you know, a large number of people. Why and how do, you know, the other industrialized nations get lower prices for pharmaceuticals? Because they negotiate for those with the pharmaceutical industry. This allows for that to be something that happens, that regularly happens. So hopefully we would get into a situation where, frankly, pharma would not be able to do what they're doing with insulin. You're absolutely right. It's absurd. It's really very destructive.
Hi, my name is Robin, and I'm disabled and I'm on Medicaid. And in January, this past January, my local pharmacy stopped filling my prescriptions, stopped taking my health insurance because they said Medicaid didn't pay enough. Rite Aid does not take Medicaid. Walgreens does not take Medicaid. I have to go to CVS, which I'm lucky I can get to a CVS. But my concern is that, and this is also shared by my father, who said that his dentist, for example, would not take any health insurance because no health insurance pays him as much as he wants to be paid. So my question is, because you've been talking about lower cost, is will you be paying pharmacies and doctors enough money that they will continue to actually take our service without any copay?
That is the proposal here. And again, if you have a large enough entity, right, you know, if in fact all 20 million of us in New York State are in, you know, the New York Health Act, essentially, Rite Aid, all those places will clearly, you know, provide services. They're just not going to risk not being able to get people to use them. It's the fact that we're very fragmented, you know, that allows for this situation where the one pharmacy can say, we're not going to do medication.
Good evening, everyone. My question is, what is the difference, or how does the act itself affect single payer?
Well, the act itself is a form of single payer, right? It creates a single fund, you know, the trust fund, that in fact is paying all the providers.
Okay, so that's the difference. And so do you think this is going to pass before they would do single payer?
Well, if you, the issue is, will this pass before a national single payer program is, you know, entertained or passed? And I think, yes, there is a real possibility that we would in fact lead the country in terms of having something like the you know, that's the way it happened in Canada, right? Is that Saskatchewan, the province, actually created a single payer program. And then, you know, other province, you know, places in Canada agreed to move in that direction. I would argue that it would really be good not so much to have a whole variety of state programs. Ultimately, we really need a national single-payer program. We always, by the way, talk about this as an improved, you know, expanded single-payer Medicare for all. Those little adjectives before Medicare for all is what really is where we're going nationally.
Hi, my name is Kaylin Kopish, and I'm a member of National Women's Liberation. We are huge supporters of this bill, but I just wanted to ask, so we could discuss it, if the New York Health Act will be providing full access to abortion and birth control services.
My understanding is that reproductive health is a component of the New York Health Act. Yes.
And that includes full access to abortion.
Full access.
To abortion and birth control.
Well, it doesn't explicitly, as I understand it, mention abortion, but it does talk about reproductive health.
It's already.
Okay. Hi, my name is Peter Pacheco. I'm a registered nurse, and I'm NYSNA delegate, and I am sure that we're going to pass this because it is one of our key issues, and we're not going anywhere. We're committed to get health insurance to everybody in New York State, and then to the rest of the U.S. I think that we need to maybe also look at starting to divest from the health insurance company. because they are as unsustainable as the fossil fuels. And I know that there's been a big divestment movement in especially universities, and I was wondering if somebody could speak to that.
Well, I think it's a very interesting idea, and another way to, in an indirect way, to support the development of a single-payer approach. What he's talking about is the idea that, many universities actually have investments in insurance companies. And what you would want to see them do is actually to withdraw their investments in U.S. healthcare, so on, as a way of saying, well, look, we really want to move toward a single-payer approach to this. Whether we can, get those entities to do this is a very interesting question. It certainly is an exciting idea that students might begin to make those demands on their universities, that faculties might. The same would be true for other nonprofit entities, where one might in fact see this as a demand. So it's an interesting idea. I'm not sure that anyone has actually pursued it.
Yeah, but it's also very interesting because many of the institutions and health insurance companies are merging these days. While Cornell, but Mount Sinai has its own HMO. So yeah, it's interesting how what's happening actually is that they're all merging, and that's not very good because, again, it's a profit-making institution or proposition. They claim to be nonprofit, but when you look at what their objective is, it's really not to provide the best service. They're looking to be efficient by cutting costs. From experience of a person who works with seniors, senior citizens consume about 60% of healthcare in this country. But when we look at the measures that they take to provide healthcare, when they talk about telemedicine, when they talk about more ambulatory care services because they want you to go home and not stay in the hospital, and they want you they want to discharge you without the proper plans and not the proper home care available. That is a contradiction. So it's very much a contradiction of asking people to divest themselves from a system that they're trying to monopolize. So I think that's another conversation for another time.
No, I think it's an interesting proposition. I mean, one thing that is, again, very interesting about New York is that none of our hospitals are explicitly for-profit institutions. What does that mean? It means that they don't actually have investors and get dividends, essentially. Yes, they can make money, but that money then usually has to be, in fact, plowed back into the provision of services, or it may go to some of the CEOs and high management folks in the nonprofit entity. But you don't have a situation where you actually are paying dividends to investors in, hospitals in New York State.
So, in the interest of time, close Q&A, but please stick around afterwards and have more of this conversation. So, I'm going to end with ma'am over here as well as the gentleman right here.
Hi. So, another scenario we were talking about, having a national system versus statewide system, and I know that Governor Cuomo has also is concerned about the large costs sort of upfront in the first years before sort of reducing costs. I mean, I'm a huge advocate. I'm out here with a lot of these ladies here advocating for it, but what can we do to respond to that?
Well, one of the interesting things that has happened is that there has been an economic analysis done of the New York Health Act by the Rand Corporation. It was before a criticism of Gerald Friedman that he was a little bit of an advocate for single payer, but the Rand Corporation clearly isn't. And the Rand Corporation came out favoring and saying that actually it was feasible financially for New York to create, through the New York Health Act, a single payer state situation. So what we have actually is a, middle of the road, I'm not sure I'd call it conservative, but a middle of the road foundation that's done an economic analysis that says it's possible. It's possible to do this and to save some money in the process. Yes, initially there may be some, the budgetary cost of this will look very high because in fact healthcare is a very expensive proposition. But it will be cheaper ultimately for both employers, employees, Medicare people who are contributing to buying premiums, Part B and Part D. All of those people are likely to do better off in terms of their financial investment in this. And the Rand Corporation has said, yeah, it's possible. And that's, I think, what we would bring to Governor Cuomo and say, look, there is an entity that is not, a left-wing foundation or anything of the sort that has in fact made that analysis.
And another thing is that when we've gotten to a point where health insurance companies are dictating what healthcare is being provided, we know that there's trouble, that's trouble. So, putting it as a single payer, entity where there's only one organization that is overseeing the payments, there's no ad, not 18%, 30 times. New York State has about 30 health insurance companies. So those figures that you were talking about, 18%, of each company goes to things that are not healthcare. And by the way, from a Medicare perspective, those are taxpayer dollars that are going to pay for private corporations and private salaries and other things that are still not providing healthcare. So there are different interests that are being created that is not for the benefit of us or our well-being. So I think that that this is a much better solution. It's more pure and it's a lot more efficient when you're only spending roughly 2% of the budget on something on administering a program.
So I think for our last question, the gentleman over here, and then we're going to close our Q&A section.
I'm Benjamin, I'm a medical student at Downstate. This is a question for Dr. Klein. So I'm curious what the conversation is like between doctors regarding single payer, and especially nationally, because medicine as a whole tends to lean conservative, at least out of New York State. So can you speak to any compelling arguments you've heard against single payer for physicians, because that would be unexpected blowback in the national conversation about single payer?
I think what's interesting here is that it depends a lot on the specialty of the physician that you talk with. Now, polls have been done, using the AMA master file, so that it's representative of a broad section of physicians in the country, and 58% of the respondents actually say they favor, government involvement in the system. and even single payer. So that conversation is there. But I think, yes, there are particular specialties that are probably not going to be able to continue to be the very high earners, such as, cardiac surgeons, neurosurgeons. They tend to have, multi-million-dollar incomes. Primary care doctors, they will clearly do better under a national health insurance system. And, if we look at the professional societies in this state, the one professional society that has actually endorsed the New York Health Act is the Family Physician Group, okay? This is a dialogue that is going on, certainly among physicians. I have to say, really a fascinating thing. Today, I just had lunch. Serendipitously, I just sat down next to one of our very senior physicians at Cornell, and he said, things are just so bad in my practice. I just want to see this, in fact, go to what you're in favor of. He kind of knew I have a reputation at Cornell. Have it go to a single payer approach. So, I think this is very actively being discussed. It would be interesting for students, I've encouraged them to do this, to actually try to do a survey of their faculty and get an idea. When this was done at the University of Chicago, they again were able to get roughly a majority of respondents who favored moving in this direction.
That's a really great place to end. I want to thank our panelists so much for their time and for their expertise. That's my work with you all. I know we cut things a little short, so please stick around and continue the conversation after, but I'm going to turn it over to Katie.
Okay, just a few closing words. Everybody has the pledge to action form. We don't want you to leave tonight without the opportunity to stay connected with the Campaign for New York Health and the Caring Majority. There's a few key flashpoints for activism in the near future. First of all, I don't know if it was mentioned, I think it was, that the New York City Council has introduced a resolution in support of the New York Health Act. Cities and counties all over the state, I think almost 20 have actually passed such resolutions, and we haven't seen it happen in New York City yet, which we think is unacceptable. We're hoping to change that in the very near future. There is a hearing where you, anyone, the public is welcome to testify on Thursday, December 6th at 1 p.m. in City Council to talk about why you want the New York Health Act to pass and why New York City needs to get behind it. So that's on here. Check that box if you'd like to attend or speak at that event. The Caring Majority is going to be hosting a teach-in strategy phone call to learn more about the fight to win single payer and universal long-term care on December 12th. You'll see the RSVP information on the forum. And they're having a strategy meeting on December 13th. These are some key events in the near future you can plug into. And a number of other ideas about how you can spread the word in your community. We have a campaign where we're asking businesses to endorse. We're canvassing and having conversations with our neighbors using a survey, the Healthcare Rights and Access Survey. We are going to push for a vote in 2019 in the Assembly and in the Senate. I know Dr. Fine said there would be no vote, but I'm here to say that's up to us if there's going to be a vote on the New York Health Act in 2019. We're at core grassroots movement, making things happen in New York. Oh, it's 2018. Well, there was a vote in the Assembly, right? You passed it in the Assembly, but not in the Senate. I see, I understand. So it's really important to know we're going to keep pushing and we're going to keep the heat on the governor to do the right thing, and together we can make healthcare happen in New York. Thank you all so much.